So this is a commitment that AACR has had now for 10 years to really sponsor this conference focused on the science of cancer health disparities. And it really is a unique conference in that this is the place where those of us working on cancer health disparities come together each year to talk about our research, to work together, and to really try to advance the field forward. And so I think it's part of that AACR's vision in the beginning to set this conference in motion, and to be able now to carry it through to the 10th year is a great accomplishment for us.
It's going to span all aspects of cancer related to disparities, including some pediatric cancer. There are going to be a couple focus areas, particularly on environmental influences for cancer.
One area that we're focusing on is rural populations. So historically, rural populations have not gotten as much attention.
We'll be looking at the effects of diet on the microbiome and how that relates to different types of cancer. We'll also be looking at obesity and how that impacts different types of cancer. There are 4 co-chairs for this year's conference: myself, Dr. Rick Kittles, Dr. Electra Paskett, and then Dr. John Carruthers. And so each of us brings unique backgrounds and expertise.
So we give different perspectives from our expertise, but it all comes together. And so when we talk about issues where we want MICR to focus or function or come up with programs, we have input from people of various backgrounds to make a real comprehensive program.
When you put all 4 of us together, you really have the entire spectrum of cancer research and an example of how we all need to work together in our different disciplines to address the cancer burden.
Part of it is thinking about how can we really implement the things that we know today that can impact cancer disparities, and then also thinking forward. What are the new horizons in terms of the concepts of precision prevention or the concepts of precision medicine? Can we better understand the nature of different populations, what sorts of treatments they might benefit the most from, that might be different from other populations, and as a way to improve outcomes among cancer survivors?
Over the last 10 years, something called genome-wide association analysis, GWAS studies, were done, but they heavily focus on people of European descent. Now there have been studies that have been adding African American and in some cases Native American and patients. So we're now getting more information from these types of studies, which have gone up, maybe not exponentially, but have gone up in recent years, and understanding what areas of the genome to look at in specific populations.
We are also putting a big focus on even underrepresented minorities, which include the American Indian and Alaska Native populations. That's a population that's really starting to receive a lot more needed attention now that we haven't seen in the past.
This field is moving very rapidly, but there's this potential for underserved populations to be left behind in that progress. And so I think one of our larger goals is making sure that the advances that are being made are really being applied equitably and will impact all patients diagnosed with cancer. It's just been enormously valuable to have this unique forum where, again, all of the investigators who are the leaders in the field, as well as those who are the rising stars, and well as students and postdocs, are all able to come together to learn about the latest science, to share ideas, to develop new collaborations. And AACR has really been critical to making that happen.
I think there's 2 ways that young investors can benefit. First of all, they'll be at a very exciting conference, and so they can hear the latest research in this area. Second of all, they'll get to interact with the researchers who are in this area, and they can benefit by individual one-on-ones or hearing us speak.
These people are going to be leaders in cancer research. When I'm 6 feet under, I'm hoping some of these young postdocs and pre-docs, are carrying the mantle.
Disparities are seen essentially across all cancer types. And so I think by shining this spotlight on these underserved populations, we have the potential to directly benefit patients. I think one great example that was presented a few years ago at one of these meetings was the health policy changes that were made in the state of Delaware, where there was a clear disparity in colon cancer incidence and mortality rates between African Americans and European Americans in their state. They had a bipartisan support to say we're going to implement population-based screening for colon cancer in our state, we're going to fund it, and then within a few years, that disparity was erased. And so that is the kind of potential impact that we can see through coming together, learning about how they made that happen, bringing that to other states, and also applying it to other types of cancer.
Our goal is we want to eliminate cancer. And in order to eliminate cancer, we have to eliminate cancer in everybody. And if we don't pay special attention to those groups that actually have higher incidence rates for some cancer, do worse once they get those cancers, have a higher prevalence of the risk-causing behaviors, then we're never going to eliminate cancer.